All right, we're back. Hello and welcome to the DocBuddy Journal. I'm your host, Eric Sunset. Here at DocBuddy, we deliver healthcare solutions that take the pain and cost out of broken workflows from the ASC to the clinic to on-call at the hospital. DocBuddy helps providers access, create, and move data seamlessly, all from the point of care. Check out all of our solutions and set up a demo at docbuddy.com. And for those that we met in Biloxi, Mississippi this week at the Gulf States ASC conference, great to have seen you there. If you were there and didn't get a chance to stop by the DocBuddy booth, I hope you'll reach out to us at docbuddy.com so we can get you what you need, get you a look at our OpNote solution, which gives you the power of instantly generated operative reports. And I bet there is a subset of you who are at the Gulf States annual conference who will see us next week at the Becker Spine, Orthopedic, and Pain Management Driven ASC 21st Annual Conference next week. And for those who are not in that Venn diagram of having gone to the Gulf State show and going up to Becker's next week, we'll be there for you too. Becker Spine, of course, is June 19th through the 22nd in Chicago at the Swiss Hotel. DocBuddy is booth number 102. So we are really excited to once again support Becker's and be a part of the spine, ortho, and pain management driven ASC conversation. And I think for the last time, at least for the foreseeable future, at the Swiss Hotel too. Certainly not the last time for DocBuddy to support a Becker's event, but I think this is going to be the last one, at least for the next little bit, that is at the Swiss Hotel. They're moving it to the Hyatt just down the street for Becker's ASC, regular ASC, the general Becker's ASC show this fall. So we'll see you at both of those and many other shows between now and then. And check out our prior episode to see exactly where we'll be over the course of the summer, and we'll let you know where we'll be through the fall. And with an eye towards next week's Becker Spine, Orthopedic, and Pain Management Driven ASC Annual Conference, let's take a look at some fast facts around outpatient spine care. And that makes a ton of sense for us to do. Obviously, DocBuddy has a ton of users of our OpNote solution in these spine and ortho ambulatory surgery centers. Our enterprise product also serves physicians at their clinics. So that's our clinic-based EHR integrated product, which is saving at least 3 minutes worth of patient documentation time per encounter for providers. So very much in focus for us to share from Becker Spine, 10 insights, stats, and more. And this episode will obviously, excuse me, this episode will obviously have the link to the article in the show notes. Sorry about that. Had to hit pause there so I'm not coughing straight into your AirPods or to your computer speakers. So let's take it from the top. Did you know that outpatient spine procedures grew among Medicare patients between 2010 and 2021 with significant yearly growth at ASCs? These findings in the March 2024 issue of the North American Spine Society Journal found that the total number of outpatient spine procedures rose about 193% from 2010 to 2021. So that's a big jump. And for those in the facilities, you'll probably agree with that number. The compound annual growth rate for outpatient cases per year was 9.9% for hospital outpatient departments, or HOPDs, and almost 16% for ASCs. So that's fantastic. ASCs are that triple aim of healthcare, better for patients, better for providers, and better for payers, or the system, the economics of it, if you will. The article goes on that while spine surgery is growing in the ASC setting, some factors are slowing its momentum. One of those is pain management, according to Dr. Harold Deutsch of the Rush Spine Center in Chicago. Quote, spine surgeries are painful, and different patients have different responses to surgeries. Some patients having exaggerated pain responses requiring more immediate nursing care. Dr. Deutsch continues, while generally most patients could have outpatient surgeries, it can be difficult to predict which patient will need a longer stay. Throw in my 2 cents into the ring here, being that I'm the host of this show. Nobody asked for these 2 cents, but you're going to get it anyway. This seems like a fantastic opportunity for some patient outreach ahead of scheduling the procedure. Scale of 1 to 10, how well do you tolerate pain? And if that number is really low, I don't tolerate pain well at all, maybe it makes sense to have that surgery at the HOPD, the aforementioned HOPD, whereas those with a higher tolerance for pain or for duress, I guess, if you will, it may make more sense to have them in the ASC. Consumerization of healthcare is coming. Questions like this in advance of a procedure or in advance of scheduling the procedure, probably well overdue if you are a clinician trying to make that prediction on behalf of a patient. Moving down the list here. Number 3, the most common spine procedures done at ASCs include back injections and spinal fusions, and that's according to U.S. News and World Report. Another quick, did you know? There are more than 200 ASCs that offer spine surgery in the U.S. And here's where it gets a little bit interesting, where we look at the difference in Medicare coverage or CMS coverage for the costs of these fusion of lower spine bones, posterior or posterolateral approach, which is code 22612 for my billers and coders out there. And this is comparing the charges at a hospital outpatient department versus the ASC. So for these fusion of lower spine bones, posterior or posterolateral approach, code 22612, at the ASC, the total cost is $10,270, of which Medicare pays about $8,200 and the patient pays just about $2,100. At the HOPD, the total cost is about $3,200 higher than the ASC at $13,560, of which Medicare pays almost $12,000, and the patient's responsibility comes to $1,700. So a little bit of an interesting fact and finding there. We just talked about the growth of spine procedures at the ASC versus the HOPD. Spine procedures at the ASC increased more than those at the HOPD, according to the data, despite the fact that the total cost of the HOPD is higher. However, the patient responsibility is about $300 less. So as a surgeon, determining where to schedule your procedures, obviously money talks and you know what walks. However, we're not talking about huge differences in reimbursement here, although there is a difference and there's something to be said for that. You know, we've talked about this on episodes prior. Being a provider in business means that you have to make money and remain profitable. So there's a fine balance there in providing the best possible outcome for your patient while also managing your own revenue. Coming down the line to number 6, on average, CMS covers more for the cost of cervical disc replacement through the anterior approach, which is code 22856 at an HOPD, hospital outpatient department, compared to an ASC. The total cost for said procedure at the ASC is quite a bit lower than at the hospital outpatient department. So at the ASC, the cervical disc replacement through anterior approach, the total cost is $13,500, call it, and we're rounding here just for giving you a better listening experience, versus the HOPD's $17,700 total cost. So about $4,000 more expensive at the HOPD, where Medicare is paying $10,800 at the ASC versus $15,000, actually call it $16,000 at the HOPD. So a $6,000 split there for what Medicare pays. And it's about a $1,000 split where the patient pays more at the ASC versus the hospital outpatient department. So pretty interesting there. Again, needing to weigh the benefits, the risks, the revenue of performing this procedure at the ASC versus the HOPD. Obviously, the devil's in the details there. Number 7, spine and ortho robots can pose a barrier to ASCs that want to invest in the tech, but a strategic approach can turn the heavy upfront cost into a smart investment. We will quote here from Dr. Brian Fiani, DO of Mendelsohn Kornblum Orthopedic and Spine Specialists in West Bloomfield, Michigan. Quote, ambulatory surgery centers should consider factors such as cost effectiveness, patient outcomes, surgeon experience with robotics, and potential for increased efficiency and precision in surgeries. Dr. Fiani continues, conducting a cost-benefit analysis and consulting with surgeons and industry experts can help inform the decision-making process. So wise words there. I don't have a whole lot to add to that. Before you spend big money, you should be sure you both A, really need to, and B, really want to. So well put there, Dr. Fiani. Continuing down the line here with number 8, spine surgeons are eyeing complex cases for the outpatient setting, but it will likely be a gradual process. Dr. Brian Gontwerker, MD of the Craniospinal Center of Los Angeles said, quote, more ASCs will need to get special exemptions to hold patients greater than 23 hours. Some ASCs should stick to the simple, safer, and better margin surgeries. For those wanting to push the envelope, I recommend doing a careful safety analysis with a multidisciplinary team of anesthesiologists, pain physicians, internal medicine, nursing, and surgery staff to decide what is safe and feasible. Just because you can do a surgery in an ASC setting does not mean you should. Any transformation into a higher acuity center should take place gradually with very careful consideration of each patient case and its appropriateness for the ASC setting. So once again, wise words there, pushing the envelope and having that multidisciplinary approach, prudent, good thinking, a good way to analyze your situation. Coming down to number 9, our first to last point from the article, orthopedic surgeons working at outpatient care centers are paid more than their counterparts in any other practice setting on average, according to May 2023 data from BLS, that's the Bureau of Labor Statistics. Well, the mean annual wage for orthopedic surgeons, excluding pediatric surgeons, is $378,000. The mean wage at outpatient care centers reaches $429,000. And finally, number 10, Center of Excellence designations and direct-to-employer contracting could play a key role in ASC growth for spine surgery. Here's a quote from Dr. Philip Louie of Tacoma, Washington-based Virginia Mason Franciscan Health. Quote, as the healthcare landscape is pushing toward an eventual value-based care model and potential smaller population-based models, outpatient surgery centers need to better harness data and analytics. Dr. Louie continues, precision analytics and time-driven activity-based costing will be crucial for driving clinical and financial performance in these outpatient surgery programs. Again, not a whole lot more to say there. I can offer my opinion on that point. With some of these, it depends scenarios. So what we just heard from Dr. Louie there, using analytics to guide your decision making, so time-driven, activity-based costing, like that's an analytic in my book. For the ASCs that are wanting to push the envelope from that Dr. Brian Gontwerker stat, where you may want a higher complexity procedure and need clearance to hold a patient greater than 23 hours, you need that multidisciplinary team. A little data wouldn't hurt that process either. And then going back in time, one more bullet point from Dr. Brian Fiani about the investment in surgical robotics. You need data. You need data. And we're starting to see ASCs embrace that. We're hearing that there is a lot of data available, but maybe not all of that data is actionable. Or maybe facility employees aren't totally sure what they should be doing with that data to provide a better patient experience, a better patient outcome, to streamline their revenue cycle. So not only to get paid faster, like something that our OpNote product helps both the facility fee and professional fee do, but to be sure you're not leaving any money on the table as you perform these procedures. So that's it for this week. Again, we will see all of you at the Becker Spine event next week in Chicago. DocBuddy is booth number 102. Stop by. We mentioned OpNote just a second ago. Stop by, check out our OpNote solution, check out our surgery workflow solution. You'll also be able to pick up a little bit of swag, a little DocBuddy swag from the booth to take home, something that you can use over the course of the summer or anytime that you have a cold drink in your hand, you want to stay cold. We got some excellent slim can koozies that we give away. Figure you guys like that more than the pens, than the notepads, than the stuff that maybe doesn't make it out of the exhibit hall, gets filed in one of those cylindrical containers. So with that, on behalf of the entire DocBuddy team, thank you for listening. Be sure you're subscribed on Apple Pods, Spotify, and YouTube so you always get the newest episodes of the show. And until next time, I'm your host, Eric Sunset. I'll talk to you again soon.